Hi friends, welcome to the world of dental aesthetics. Today myself Dr. Priyanka Yadav. I'm here to discuss about endodontic biofilms. Main aim in the management of an endodontic disease depends upon the removal of the biofilm from the root canal system. Further, if we talk about the different types, the composition, it will be a big topic to discuss. So, just a brief tips and types of biofilms. We talk about the types of biofilm. First is intracanal, second is extraradicular, third is your periapical, and the fourth is centered biofilm. The formation of biofilm involves three basic steps. First is the pellicle formation. Second is the colonization of all the bacteria to that particular area. Once they have colonized, the bacterial maturation. So if we talk about the intracanal biofilms, these are the biofilms which are formed on the root canal dentine of the infected tooth. Second comes your extraradicular biofilms. These are the biofilms which are formed on the root surface of the root apex of an endodontically affected or infected teeth. Thirdly, the periapical biofilms. These are the biofilms which are present in the periapical region of the root apex, and they are found as an isolated type of a biofilm. Even if the root canal is absent, we can see such kinds of biofilms. Talking about the foreign body centered biofilm, these are the biofilms which are formed around a foreign body. As the name suggests, the foreign body centered biofilms. So whenever there's a foreign body or an artificial biomaterial, so there's so many biomaterials which we are putting on the root apex. Sometimes it goes beyond. Or these are the type of biofilms which are mainly associated with implant supported processes. Now, how do we eradicate this biofilm? Firstly, by use of proper irrigating solutions. There are different type of irrigating solution. First, if we talk about the sodium hypochlorite solution. Secondly, we have chlorhexidine gluconate 2%. We have normal saline also, but it does not help in removing the biofilm. Then we have metrozole solution. We have our hydrogen peroxide and so on. We have tetracycline like MTAD, we have ethylene like EDTA, and secondly by proper instrumentation. How do we do that? So microorganisms grown within the biofilms, they are 1000 to 1500 times more resistant to the antimicrobials which we use to eradicate the biofilms as compared to a bacteria. So the most commonly used irrigating solution, just so most commonly used so the most commonly used irrigating solution for the eradication of your this biofilm is sodium hypochlorite. Sodium hypochlorite is very effective in removing the multi-species biofilm. So the sodium hypochlorite, why it is so widely used? Because of its two main properties. First is the antimicrobial action of the sodium hypochlorite, and secondly because of its tissue dissolving activity. Secondly, if we talk about the chlorhexidine, it is also a very broad spectrum antimicrobial disinfectant. It is used for its antimicrobial and a soaking activity for the E. fecalis. So both the sodium hypochlorite and your chlorhexidine, they're effective against the E. fecalis. We always talk about the use of EDTA for the removal of smear layer. So other than the purpose of removal of smear layer, this EDTA can also be used for the eradication of your biofilms. And which all intracanal medicaments help in irrigating of your biofilm? Firstly, we can talk about the calcium hydroxide. It also has an antimicrobial action by the release of aqueous hydroxyl ion, which raises the pH. Whenever there's an infection in the root canal system, the pH goes to acidic or pH reduces. So whenever we are giving an intracanal medication of calcium hydroxide, it can be mixed. It comes in powder form. You can mix it with chlorhexidine 2% solution. You can mix it with like metrozole, you can mix it with normal saline. So it aids with the effect of the calcium hydroxide. So here what calcium hydroxide does, it releases the hydroxyl ion. Because of the hydroxyl ion, the pH of the root canal system increases, which disrupts the membrane integrity of the bacteria, and that is how the bacteria from the root canal biofilm gets eradicated and the biofilm gets removed. Secondly, in second intracanal medicament, we can also give like triple antibiotic paste. The triple antibiotic base, as the name suggests, it is triple antibiotic. First is metronidazole, second is ciprofloxacin, and third is minocycline. These all the three medicines are the mixed in ratio, and then they have to be mixed with normal saline and placed inside the patient mouth. It helps in treating. It has been widely used in regenerative endodontics. Other than that purpose, it can be used in eradicating the your biofilm and treating different endodontic pathogens. So we have different irrigating solutions. We have talked about irrigating intracanal medicament, but intracanal irrigating solution we have talked. How do we use them? First, we have to use side rental needles. Secondly, the irrigating solution should be activated with our ultrasonic devices. That is a must. So this is all about the endodontic biofilms. So if you have any query or any questions, please WhatsApp or please you can directly message me on Instagram and Facebook. And stay tuned with me for the next update.